this morning for taking your Saturday morning. So, who has atrial fibrillation? Wow. Okay. Who's here because they're with a family member or have a family member who has atrial fibrillation? Quite a few of you. Wow. Who's just here to learn about atrial fibrillation and hope they don't have it? Okay. Well, I can absolutely empathize with you because I have atrial fibrillation as well. It was 2003. I was 51 years old. And at the time, I was a high-tech road warrior. One evening, I got off a plane, and I realized that I could barely breathe, and my left shoulder hurt. I had just read in USA Today, and you may have read the article, that women have different heart attack symptoms from men, and I had 2 of them. Okay, thank you. I had 2 symptoms that women have of a heart attack. Luckily, it wasn't a heart attack. But I had a 95% blockage in a major coronary artery. And on the operating table, I almost died. I got a second chance. I knew I got a second chance for a reason. So I took what I had experienced and started spreading the word. Because at the time, back in 2003, most women didn't know that heart disease is the #1 killer of women, and stroke is number 3. Did you know that we lose more women to heart attacks than men? And we have for 20 years. Why wasn't anybody talking about this? We lose, if you take heart disease and stroke together, #1 and #3, we lose 10 times as many women to heart disease and stroke as to breast cancer. And most women at the time thought that breast cancer was our #1 enemy. And we lose twice as many women as to cancer, all cancers combined. Somebody needed to be talking about it, and it might as well be me. So I took that on as my mission. I had the opportunity to do lots of research, to write a book, A Woman's Guide to Saving Her Own Life. And I set out to spread the word. But heart disease is forever. Once you have it, you're more at risk for other things. One morning, a few hours after I'd gotten off a plane, I was sitting at my desk in my home office pulling email. My heart skipped a beat. And then it started racing, and I got dizzy. My right leg went cold. My right eye went fuzzy. I had blood clots and a near stroke from atrial fibrillation. And I knew how deadly stroke could be. And not only is it deadly, but it's the #1 cause of permanent disability. Well, my doctor said, I'm going to put you on a beta blocker and also on a blood thinner, Coumadin. Thought, that'll take care of it. Well, a few days later, I was out walking my dog. We were about a half mile from home. And all of a sudden, the heart skips a beat. Starts racing again. I'm sorry. My heart skipped a beat. And it started racing again. And I looked at my exercise heart rate monitor. 170, 200, 230, 250, 270, 300. Am I going to pass out right here? Am I going to have a stroke? Dave, come get me. My heart rate's over 300. Where is he? Come on, please. I don't want to have a stroke right here. Oh, there he is. Come on, let's go home. I need to get a beta blocker. Well, the beta blocker stopped the atrial fibrillation. But after that, every time I would go anywhere, I would take with me my pill in the pocket and my cell phone. Even if I was just going to the mailbox. I never could figure out what was causing it, what was really triggering my atrial fibrillation. Sometimes it'd come on after I ate. Other times after just bending over. But then other times I'd bend over and nothing would happen. Sometimes it'd be related to stress. But other times stress wouldn't trigger it. So I never really could figure it out. But AFib became my constant, or my near constant companion. I was always scared. When am I going to have my next episode? You guys understand that, don't you? Constantly living in fear. When is the next time? AFib becomes frequent and it becomes frightening. When you've had when you've had a near stroke and you've had blood clots, living with atrial fibrillation is not normal. So as a result, my family traveled with me. They wouldn't let me out of their sight. And you can imagine what a toll that takes when your whole family is going with you everywhere you're going. Or someone's always with you because of the concern, because of the risk. You know that atrial fibrillation takes a huge toll on you. It's physically exhausting, emotionally draining. And it takes a huge financial toll as well. Some people miss work, lots of work. Other people lose jobs because of AFib. And then there are the medical bills, the trips to the emergency room, all the cost of the medications and the treatment. And for some of us, if you have heart disease or you have atrial fibrillation, you can't get insurance. So the toll is tremendous. And I know many of you understand that. I hope that many of you don't, but I know some of you do. The toll is tremendous. But you don't hear much about the financial impact. It's really just too embarrassing. Too embarrassing to talk about. Well, the worst, however, was the Coumadin. How many of you are on Coumadin or warfarin? Wow, most of you are. Is it working for you?
I don't know.
Okay, you don't know? Okay. Okay. So some of you have real problems with your Coumadin? A few of you have? Okay. Those of you that have Coumadin under control are really lucky. Not me. I didn't have it under control. Being on Coumadin meant weekly trips to the Coumadin clinic for a blood draw to check the INR, the International Normalized Ratio, to check whether my blood was too thick, too thin, or normal. It was never normal, never. So because of that, that meant constantly adjusting the dosages. As I ping-ponged between blood that was too thick, with the risk of clots, and too thin with the risk of bleeding to death. And then Coumadin also means no yard work, no kitchen knives, no using a razor to shave your legs because of the risk of cutting yourself and not being able to stop the bleeding. And then, as Dr. Shukla mentioned, then there's the bruising. How many of you have had severe bouts with bruising? Coumadin will definitely do that, won't it? Well, did you know that when your blood's too thin, it will leak out of your blood vessels? And that can cause bruising. Even, a slight touch or a slight bump will cause bruising. But sometimes you have bruises come up in places that you know you didn't bump. You know you didn't touch. It's just because of leaking of the blood out of the blood vessels. So as a result, I was covered. Black, blue, and purple bruises. My arms, my legs, my torso, even my face. You haven't lived until you've tried to cover purple and black under eye circles. Loads of fun. And of course, the worst part of that, wherever we went, I could hear my husband telling people, it's the Coumadin. She's not battered. Right? The worst of the husband. Some of you may have heard from your doctors that, and from other people, that if you eat right, you'll be fine on Coumadin. And that may be true for a lot of people, but it's not true for everyone. At least it wasn't true for me. If you're stable on Coumadin with what you're eating, you're lucky. But not me. So in the summer of 2005, research came out that indicated that about a fourth of Coumadin patients are never stable on Coumadin for genetic reasons. If you're 53 years old and you're looking at spending the rest of your life on Coumadin, is that a good prospect? How many of you would choose to do that? I don't see any hands going up. No. I didn't want the nightmare to continue. So I started looking around. We looked into, my doctor and I both looked at catheter ablations that Dr. Schuchler just spoke about. At the time, the risk seemed too great, the success rates too low. So for us, it wasn't a good choice. We chose to say no to catheter ablation. There's been a lot of progress since that time, but at the time we said no. But then my engineer husband happened to come upon a surgery for AFib. Minimally invasive surgery. No cracking open the chest, no heart-lung machine, no long recovery period. Fewer risk than catheter ablation and higher success rates at the time than catheter ablation. And no multiple procedures. Once, and you're done. I asked my doctor about it. She said, that's your solution. And she referred me to a surgeon who had been doing this procedure. Well, the surgeon spent all the time in the world, all the time I needed, telling me about the procedure, answering my questions, and I had many questions because there really wasn't much information on the internet at the time. Your doctor may not know, your regular doctor may not know about this surgery even now. It's still not widely known about. So feel free to send him or her to stopafib.org to learn more about surgery for atrial fibrillation. I'll tell you more about it in a minute. It's stopafib.org. So in visiting with the surgeon, I was really intrigued that you could do as Dr. Schuchler said. You can touch around those, you can go around those pulmonary veins, cut off those erratic electrical signals, and potentially eliminate atrial fibrillation. And oh, by the way, as part of the surgery, they removed the left atrial appendage. The left atrial appendage is considered to be the source of about 95% of the clots that cause strokes. So by removing that, that could virtually eliminate the risk of a stroke. It was a no-brainer. 10 days later, and a few tests later, I was in surgery. Tuesday, September 13, 2005. 13 is my lucky number, and it sure was. Now, with surgery, there are risks. Some patients complain about the drain tubes. I don't remember the drain tubes. The worst part for me was the anesthesia, and I mean, I was out of it and groggy for several days. The good part is, I don't remember any pain. And with surgery, you expect to have pain. I don't remember any. Some people have said they had pain, others, haven't. But I don't remember any. So, if you're a woman that's considering atrial fibrillation, let me encourage you to go out and buy some soft bras beforehand. Because that way you won't have something rubbing on the incisions. And one thing I actually suggest is that women have their surgeon mark where the incisions are going to be, so that you can try on various bras and make sure you're not going to have any rubbing from those bras. So if you want to know more about what the surgery is like and what catheter ablation is like, stopafib.org is the website that I've created to tell more about various ways to treat and manage atrial fibrillation. So there you'll find information about what to expect before surgery, during surgery, and after surgery, and then special considerations for women who are considering surgery for AFib. So, for me, I feel like I'm free again. I have been AFib free for over 2 years. 2 years and 4 months tomorrow since my surgery. So what I learned from this experience is that you can stop AFib. You can stop it. Are you struggling? Are you struggling with AFib? Do you find that you're having a hard time stopping it? It was so freeing to be over the AFib. After surgery, just 3 weeks after surgery, I was able to fly again. I had been grounded for 2 years while I had AFib because both my heart incidents happened within a few hours after getting off of a plane. I was able to fly again 3 weeks after surgery to go speak at an American Heart Association Go Red for Women luncheon. You can't put a price on getting back your life and your freedom. Would I do it again? In a heartbeat. So, what about you? Are you struggling today with your AFib? Are you on medications that maybe aren't working or maybe have really bad side effects? Are you waiting for that next episode? Or do you have a constantly flopping fish in your chest or a jiggling bag of worms in your chest? And it's going all the time. You don't have to live with it. You can stop AFib. I can. I did. And you can too. So let me encourage you to visit. Well, after my first heart incident, I wrote a book, A Woman's Guide to Saving Her Own Life. This time, after getting over AFib, I knew that I got another second chance. And I knew there was something I should do with it. I couldn't stand on the sidelines and watch you suffer. So I created a website, stopafib.org, for patients who have AFib and for their families and their caregivers. How many of you actually use the internet to do research about your AFib? Many of you. Please, I encourage you to visit stopafib.org. There you'll find, or if you have family members who have access to the internet, please have them visit and gather information for you. And at stopafib.org, you'll find things like, how do you treat, how do you manage, and how can you potentially cure your AFib or stop your AFib? You'll find news and events related to AFib. There's a news feed of all the latest news related to AFib coming off of various sources. Then there are teleseminars about living with atrial fibrillation, living on blood thinners, and there's a new one coming on living with beta blockers and dealing with the beta blocker stupids, as we call them. Because beta blockers can totally fog your brain. So there's a lot of great resource there, a lot more that you can find, and we're hoping to add some discussion forums very soon because we really have a goal of making stopafib.org the most trusted community to support people who have atrial fibrillation. So I encourage you to visit there. So my wish for you is that you all have normal sinus rhythm because you can stop AFib. So thank you for coming today. And we'll take questions when all three speakers are done. So thank you.